Physiotherapists need to understand blood work. After analysing blood work for hundreds of patients with musculoskeletal symptoms, I've discovered that we're missing crucial information that could explain why our physio treatments sometimes don't work. This sporty client had aching, fidgety legs after she'd been running or standing, and her GP had said that her bloods were fine, but when I looked at the actual numbers, I found the exact cause of her symptoms. Without basic blood work knowledge, you'll keep accepting normal results at face value while missing root causes that are sabotaging your treatment outcomes. By the end of this video, you'll know exactly which 5 markers to check and how to spot patterns that explain mysterious symptoms. I'm Nicolettas and I apply functional medicine principles to physio and pain science to find root causes and ensure my clients get the best outcome. What I'm about to share with you will transform how you assess complex patients. Here's what happens in every physio clinic. A patient comes in with unexplained symptoms and you ask, have you had blood tests? And they say, yes, my doctor said they were all fine. And we accept that and we move on. But here's the problem. Most doctors are screening for serious pathology and disease. They're not looking for optimal function or subtle deficiencies that can significantly impact the symptoms that you're trying to treat. If you've ever felt frustrated treating patients with complex symptoms that don't respond to traditional physio, this isn't your fault. The medical system is designed to rule out serious illness, not to optimize function. What I'm about to explain is based on functional medicine principles that reveal so much more from standard blood panels when you know what to look for. But first, here's the critical factor that changes everything about blood work interpretation. Most patients don't prepare properly for blood tests, and this can completely skew their results. Let me break down the quality control factors that make or break accurate blood work. First, hydration. Your patient must drink at least 1 litre of water on the morning of their blood draw and stay well hydrated the day before. Why? Because dehydration artificially elevates certain markers, making deficiencies appear normal. Second, fasting for 8 to 12 hours gives you accurate metabolic markers. And third, it's important that they don't take supplements for 3 days, as this can prevent artificial elevations. Fourthly, they need to avoid strenuous exercise, including weight training, for 48 hours to avoid skewing the inflammatory markers. Here's the shocking part. If your patient was dehydrated, their B12 could appear 30 to 40% higher than it actually is. A normal result might actually be severe deficiency. This is why the first question you should ask is, how did you prepare for your blood test? They probably didn't follow these guidelines because standard doctors don't usually give these instructions. Now let me show you the 5 markers that will revolutionise your practice. Let me start with the client I mentioned, a sporty woman in her 30s who came to me with fidgety, achy legs that were particularly bad after she'd been exercising, but also when she was standing still for long periods. Her GP said that her blood work was fine, but her B12 was 220, above the NHS minimum of 200. Case closed, right? Wrong. Here's what the research actually shows about B12. Functional deficiency begins below about 400, and neurological symptoms often occur with levels of 300 to 400. The Japanese use 500 as their threshold specifically because of neurological symptoms. This client's B12 wasn't just low, it was functionally deficient. And if she was dehydrated during her blood draw, her true level could have been as low as 150. B12 deficiency can cause exactly what she was experiencing. Restless legs, aching after exercise, discomfort when standing still, and neurological symptoms that can worsen with physical activity. But here's where it gets really interesting. So the second markers we're going to look at iron and ferritin. So there's a hidden epidemic in active people. Up to 40% of active women have iron deficiency without anemia. Even well patients with aches and pains often have ferritin levels of 15 to 25, which is technically normal, but functionally deficient. Iron deficiency directly causes muscle fatigue, delayed tissue repair, increased injury risk, and that heavy legs feeling that patients often describe. For optimal tissue healing and energy, you need ferritin levels of 50 to 100, not just above the standard threshold of 15. Here's the clinical goal. Iron deficiency can cause bilateral tingling, numbness, and sciatica-like symptoms that bring patients to physiotherapy. You might be treating nutritional deficiencies, not structural problems. When you see a patient with widespread aches and pains or poor exercise recovery and their ferritin is below 30, you might be looking at iron deficiency that's limiting their healing capacity. So the third thing we're going to look out for is vitamin B6 deficiency. But here's the clever part. You can't always test B6 directly, but you can infer deficiency from other markers which are often on standard panels. So B6 deficiency can show up as low AST, ALT, and GGT, so they're usually on the liver panel, low MCV, low MCH, and low MCHC. And you'd be looking for these markers to be trending outside of the optimal ranges. When you see this pattern, you're probably looking at B6 deficiency, and this can affect nerve function, muscle metabolism, tissue repair. It's hiding in plain sight on every blood panel. B6 is crucial for neurotransmitter production and protein metabolism, and deficiency can explain problems like muscle weakness, nerve symptoms, and poor tissue healing that might lead to poor exercise recovery and slower response to treatments. So the next marker we're going to look at is vitamin D. So the NHS considers anything above 50 as sufficient, but research shows pain can be associated even with normal vitamin D levels. For pain management and immune function, you probably need vitamin D to be more like 100 to 200. Vitamin D deficiency doesn't just affect bones, it directly impacts pain processing, muscle function, and inflammatory control. So low vitamin D can contribute to widespread aches and pains that seem unrelated to specific injuries. Here's what's crucial. So vitamin D levels between 50 and 75 are normal, but can still cause chronic pain, muscle weakness, and poor recovery. You need optimal levels, not just adequate. And the final thing that you really need to be able to spot in bloods is dehydration, because this can change so much. The most reliable indicator of dehydration during a blood draw is the BUN creatinine ratio if you're in the US, or urea creatinine ratio in the UK. And a ratio above about 100 to 1 when creatinine is normal strongly suggests dehydration. When patients are dehydrated, their hemoglobin, total protein, and key nutrients will appear artificially elevated. So you might miss severe deficiencies because the results are going to look normal. This is why asking about blood draw preparation is crucial. If they didn't hydrate properly, these normal results might be hiding significant deficiencies that explain their symptoms. Here's how this transforms your practice. Instead of accepting normal blood work at face value, you now ask, were you properly hydrated? What were the actual numbers? Do these levels support optimal function and not just the absence of disease? For my client with restless, achy legs, once we identified her functional B12 deficiency and addressed it with targeted supplementation, her aching and fidgety legs completely resolved in about 6 weeks. And this wasn't a miracle, it was addressing nutritional deficiency that was causing neurological symptoms masquerading as musculoskeletal symptoms. When you understand optimal ranges versus normal ranges, you can spot patterns that explain why some patients don't respond to traditional physio approaches. So remember these 5 key insights. Blood work preparation determines accuracy, and dehydration can skew everything upwards. B12 deficiency can cause neurological symptoms even in normal NHS ranges. Ideally aim for levels above 400. Iron deficiency is epidemic in active people and can directly affect tissue healing. And ferritin, which is the storage form of iron, needs to be 50 to 100 for optimal function.
B6 deficiency can be inferred from liver enzymes and blood cell parameters on standard panels, even if it hasn't been directly tested. And optimal ranges reveal dysfunction that standard ranges miss completely. This is where the magic happens. Understanding these 5 things transforms you from a symptom manager to a root cause detective. When you know what to look for, standard blood panels become powerful diagnostic tools that can really enhance your physio assessment. If you're treating patients with unexplained symptoms and normal blood work, start asking the right questions about these 5 things and how they prepared for their test. If you're a physio and you want to find out more about blood work and functional medicine, I have a free community. You'll find the link in the video description. And if this changes how you think about your next complex patient, hit that like button. Tell me in the comments, have you ever suspected systemic issues in patients with normal blood work?